One of the common complaints we see here in the clinic is migraines and headaches that are chronic and recurring. So it's important to know that headaches and migraines are not normal. They are not, sometimes they can happen, yes, periodically throughout our life, whether it's from stress, dehydration, hormonal changes. Sure, it can be a short period and it can pass, but it's important not to depend on medications like painkillers and such when you are having chronic headaches. Why? Because sometimes these things are structural. They are coming, their root cause is more structural. So it may be coming from muscles in the neck and the spine that need to be manually worked on. And so if you never address the actual structural issue, you will never feel the relief. And no matter how much medication we take, you are only muting the symptoms temporarily. You're not resolving any issue in the long term. Over time, this will cause more severe problems, and it's better if it's addressed periodically. Like as you get headaches, you should have them addressed or checked out by a physiotherapist or a chiropractor. So a common thing that I hear is patients are afraid to have a neck adjustment. They feel like cracking of the neck is risky, it's not safe, it will cause other issues for them. And that's understandable. Of course, everything we do in life has a risk and a benefit. And so we have to weigh whether this is more risky or more beneficial for me. With chiropractic adjustments, if you are seeing a trained specialist, a chiropractor who has studied the subject, who understands when this is appropriate for a person and when it is not appropriate, then you can ensure that you are safe. So a chiropractor should ask you many questions about your pain or your headaches. They should ask you if you have other symptoms beyond the headache. So if I have a patient who has severe headaches, they have nausea, they have dizziness, they have numbness in both their arms, these symptoms are more severe and beyond the scope of just the treatment, a chiropractic treatment or a chiropractic adjustment. This patient, I would need to assess further. I would need them to go to the emergency room. They would need to measure their blood pressure and such other things to rule out something like a stroke. So if a patient is having a stroke, it's possible that they present with such symptoms that we do treat here in the clinic, like neck pain, headaches, numbness and tingling in the hands. But when it is at a severe, in a severe state, it could be something more risky that we do not treat here. So if I don't recognize that this is happening to my patient and I do go ahead and treat them with a chiropractic adjustment, they will have a stroke regardless. I do not cause a stroke by a treatment, but I do keep the patient in the clinic too long, and don't give them enough time to go to the emergency room and have the appropriate treatment, medical treatment, to stop the stroke. So this is the difference. This is where we need to understand who is doing the treatment and whether they are taking my health into account and making sure that the risk is as low as possible. The other thing is how we perform the adjustment will of course affect the person. So somebody who is doing an adjustment in a very severe, aggressive way can harm you, yes. But that's not necessary. We don't need to do adjustment in a very rough or aggressive way. It's a gentle treatment, and if it's specific enough, it should target your problem without causing you more pain or more symptoms. So it's important to see somebody who is trained and who is licensed to do these treatments, and you will greatly see the difference between working on the spine, especially the neck, and how it reduces the frequency of headaches, the severity of the headaches. It gives you more mobility and more comfort because it's reducing the tension in the muscles all around the neck and the spine that may be contributing to your headaches.